A shocking statistic was just released by Medicare. The average person now will spend more money on medications than anything else in healthcare. And so when we go on Medicare, we have what's called Part D plans. I'm going to show you in this video how to get your medications covered at the very best cost. Now, just before I get into the details of Part D plans, I do want to give you a quick reminder of the 4 parts of Medicare. We have A, B, C, and D. A is original Medicare for inpatient. B is original Medicare for outpatient services. C plans are called replacement plans, where a private health insurance company actually replaces original Medicare for you, so you get all your coverage through that private health insurance company. And then we have Medicare Part D, which has to do with our drug coverage. All right. Now, as we talk about the details of Part D, you have to be mindful, first off, that there's 2 types of medications that we take. Okay, and they're going to be one of these 2 categories. One could be medications that are professionally administered. So this is a medication that you got either in an inpatient hospital setting or an outpatient setting. It's professionally administered. And so those meds are going to be covered through Medicare A if it's inpatient, B if it's going to be outpatient. This would also include medications that you run through a nebulizer or that you run through an insulin pump, those kinds of things. So that would also be covered through Medicare Part B. So if it's being professionally administered or it's going through durable medical equipment, A or B is going to pay for that. The second type of medications we have are those that are self-administered. So this is your cholesterol medication, your heart medication, your blood pressure medication. Those kinds of things are going to be covered through Medicare Part D. All right? So A and B covers professionally, and the D plans are going to be for those that we take on our own. So we have 2 types of meds. Now, there's 2 different ways that we can get Part D plans. So we'll just call this 2 types of coverage. So if a person decides that they are going to stay in the original Medicare A and B, most people that get A and B then get a supplemental plan. All right? That supplemental plan fills in the gaps that Medicare didn't cover, either fully or almost in full. And that supplemental plan has a separate premium. Supplemental plans will cover what Medicare didn't cover for professionally administered medications, but your supplemental plan is not going to cover self-administered medications. So if you decide to stay in original A and B and get a supplemental plan, then what we do is we add a Part D plan to that coverage. Okay. Now, what's significant about these Part D plans is, number one, you get to pick the plan. In most zip codes, we're going to have anywhere from probably 15 to 25 different plans to choose from. So you pick the plan based upon the medication that you take and based upon the pharmacy that you would like to get your prescriptions filled. So it's a plan that you picked out. It also has a separate premium that you're going to pay. And so that premium could be as low as $5 a month. It could be as high as $75 a month. Now, the average is about $25 a month. But the point is, when we have a separate Part D plan, we pick that out ourselves based upon the medications we have. So we have a separate policy, a separate company, and we're going to pay a premium for that. Hey, just real quick, we often hear from our viewers that they wish that they would have seen a video earlier because they made a decision that really wasn't in their best interest, or they made a decision without having this information and it cost them financially. And we don't want that to happen to you. We upload 3 times every week, and the only way you're going to know about our new videos is if you subscribe to the channel and hit the bell notification. We're constantly giving away brand new strategies, updates, and comparisons that you don't want to miss. So click the subscribe button below this video right now and turn on notifications so that you never miss another video. So that's one way we get it covered. The other way is if we get one of those C plans. Remember that Medicare Advantage plan. What happens when this situation is included in the plan. You didn't pick out that Part D plan. It was embedded by that Advantage company. So we have Medicare Advantage for our inpatient, outpatient, and now we have a prescription drug plan also as part of that package. Now, the negative is they pick it out. You didn't get to. So it's really not based upon your medications. Now, there are some embedded drug plans with Advantage that are wonderful. There's some that are kind of mediocre. So you always have to make sure that you have good drug coverage whenever we take an Advantage plan, because, again, you didn't pick that out. The company chose that plan. All right. Now, I do want to mention in this area of these 2 types of plans, if you are a veteran You do not have to have a Part D plan if you choose to get your prescriptions filled by the VA. If you are retired from the federal government and you have what's called FEHB benefits, this means you're a civil servant and you maybe work for the IRS or the Treasury Department, the FBI, or some government agency, you qualify for federal employee health benefits, which includes a prescription drug plan. And so you wouldn't have to have a Part D plan. Or if you actually get your medications through what is called TRICARE. And this is for people that actually retired from the military. You have TRICARE insurance, which becomes TRICARE for life once you're eligible for Medicare. And again, TRICARE will cover prescription drugs. And so those three groups of people, VA, FEHB, TRICARE, do not have to have a separate Part D plan because you can get your meds through those systems, all right? And those are all considered to be credible coverage. Now, if we ever lose that coverage, we can always go and pick up a Part D plan with no penalties as long as we do it within 60 days of losing this coverage, all right? And so the whole point is that most of you are either going to get a Part D plan that is separate, if you've chosen A and B with a SUP, or an embedded prescription drug plan. All right, so that takes us through that aspect. Now what I want to talk about is this. We also have 3 features of every drug plan, okay? 3 features of Part D plans that you have to be aware of, whether that's a separate plan here or it's included. Number 1, we are going to have a network of pharmacies. Network, okay? And what this simply means is the Part D plan that you're enrolled in will identify a couple of retail pharmacies that will give you preferred pricing. One plan may say Walgreens and Costco are our preferred pharmacies. Now, you can go to other pharmacies, but they're going to offer you standard pricing. So that's the whole point of a network. We're either going to have a preferred pharmacy or we're going to have standard. And obviously, if you have a standard pharmacy you're using, and they're not preferred in the plan, then you're going to have higher copays for that. And so the very best price is going to come to the preferred pharmacies. Now, most of the plans will give you a mail order option, and it will be considered preferred pricing as well, sometimes even a little bit better than preferred retail. And those are the details that we look at whenever we're selecting a prescription drug plan. We look at the network, and I would tell you sometimes to get your best price, sometimes you may have to change pharmacies because one plan may say Walmart's our only preferred pharmacy. Another one may say you can go to Walgreens or you can go to CVS. Those are preferred pharmacies, or maybe some grocery store or something. But the whole point is every plan is going to have a network of pharmacies, a few preferred, and all the rest would be standard, which means a little bit of a higher price. The other feature that you need to know about when it comes to Part D plans is every plan is going to have a formulary. And a formulary is nothing more than the list of medications that the plan is going to cover. Just so you know, not all medications are going to be covered by any Medicare plan, okay? But most will be. But the point is the formulary is the most important decision that we make. It's not the cost of the plan, it's the formulary. I'd actually rather have a higher premium on a plan if I have my medications covered than just some low-cost plan that's not going to cover my meds. So the formulary is the most important decision. And again, there's no formulary that's going to cover every medication. But if a medication is available, the way it works is that for every disease category, any kind of issue that people deal with for health reasons, there has to be at least 2 medications as long as they're manufactured. We have to have at least 2 medications to treat that particular disease in every formulary. All right? Now, there could be 10 or 12 medications available. I can assure you all those are not going to be covered. That plan is going to select a few of those medications that you can get, and those will be in the formulary. Now, so it's very important to note when it comes to formulary is that sometimes we will see in a formulary these initials called QL. And what that means is quantity limits. Everyone likes to get their prescription filled for 90 days. It's convenient and usually a little bit cheaper. But Medicare does not always allow a 90-day fill. For medications that are addictive or expensive, there could be a limit as to how many pills could be in the bottle. It could be 30, could be 90. But the point is you will have some meds where there be quantity limits. Even if you want a 90-day supply, sometimes Medicare will not allow that to happen. There also are some medications that you will see that is called PA, and those initials stand for prior authorization. And so what that means is that if the doctor prescribes a medication and in the formulary it says PA beside it, it just simply means that the doctor is going to have to fill out some additional paperwork before that prescription is going to be filled. It has prior authorization. In other words, that insurance company wants to know why you're taking this, and they have to approve that before the fill will occur. And this would happen with anything that's expensive, certainly even some addictive type medications medications. If it says PA, the doctor's involved. Now, the turnaround and approval process is really very quickly, but your doctor is going to be involved with that. Okay, and then also I want to let you know, and this to kind of give you kind of peace of mind, we have a thing called a formulary exception. Let's say you get on a prescription drug plan and the doctor prescribes something that is not in the formulary. Well, what do you do? Well, again, the doctor has to be involved and is going to fill out some paperwork and asking that plan to include that prescription in your formulary. If they approve it, they're not going to add it to the whole formulary for all their clients, but for you, they can add that if they approve it. So doctor says, this is why we need that medication, and they will add that to your formulary called a formulary exception. So it's not in formulary, but it is for you, and that would only be for that calendar year. So the next year, you're probably going to need to change plans because they don't have to cover it beyond that particular calendar year. So you have to be aware that there are some things that could have limitations within that formulary. All right. And then the third feature you have to know about would be term. Okay. Drug plans are only written for 1 calendar year. That's it. So if I start in Medicare in July, I'm going to be on that same drug plan for 6 months. If I start in January, obviously I'm going to be on the plan for 12 months, but they're just a 1-year plan between Medicare, the insurance company, and you. And so that plan has to be very true to that particular plan for the year. Now, if the FDA pulls a med, then they can certainly, pull that medication. But other than that, they have to be true to that because you made a year-long decision. So it's a 1-year agreement. So what happens is prescription drug plans and Advantage plans, if you have an embedded plan, October 15th through December 7th, we have what is called the Medicare annual enrollment period. And those dates are etched in stone. It happens every year. And this is the opportunity for you to switch your drug plan, either the embedded one, so you switch Advantage plans, or if you have one of these standalone plans, you can switch to another standalone drug plan. And so we have this 7-week period that we have to do it. So if we're going to switch drug plans, we have to make the decision during this period of time. And then that new plan, again, remember, they're only good for a year, so it'll go into effect January 1 of the next year. Now, the truth is, I would say 80 to 85% of all people don't have to switch their drug plan. The one they're on is going to work for the next year. But sometimes the plan changes something that is adverse to you, meaning they dropped a medication from the formulary. They re-tiered a medication, which means they bumped up the copay. Maybe they changed their premium. Occasionally we'll see that happen, where a plan this year it's $23 and next year it's $69. And so the plan can change whatever they want year to year, so that gives you the right then to switch plans if you need to do that. All right? And so those 3 features are going to be a part of every single prescription drug plan, whether it's embedded or it's a plan that is separate. And then last thing I want to show you, what we call the 4 stages of drug plans. Hey, if you're finding this video helpful, I want to invite you to go right up here and actually click on a link that will allow you to watch what I call the Medicare Essentials Workshop. It's a workshop that I did that really is going to show you everything you need to know about Medicare from A to Z, how to enroll, when to enroll, and the plan options for you. So go to that link and check it out. So lastly, I want to share with you what is probably the most confusing part of Medicare Part D plans, and that is the issue of having 4 copay stages. And what I mean by that is that you can be on a drug plan in 1 year, you actually could have 4 different co-payments, 4 different out-of-pocket expenses for the same medication in the same year. Now, the way to understand this is make a very simple comparison. If you're still working or you were covered by a group plan or an individual plan, you didn't have 4 stages. Employer plans and individual plans have 1 stage. That means that you have a medication that's covered, and the copay is based upon the tier of the medication. So if I'm on a tier 1 medication, my copay may be $5. Tier 3 may be $50. But if I'm on a group plan or an employer type plan, an individual plan, I have 1 stage. So that copay that is established is fixed for the whole year. So it doesn't matter on that plan if I get the medication in January or July or December. If it's a $5 copay, it's $5 all year. If it's a $50 copay, it's $50 all year. That's a 1-stage plan with fixed copays. Medicare doesn't work that way. We have 4 stages. And so that means that what we have is we have fluctuating copays. The medications can go up, they can go down, and so we have fluctuating copays. And so these 4 stages would exist if I have an embedded Part D plan with my Advantage, or if I have a separate standalone prescription drug plan that I picked out, it also is going to have 4 stages. So let me explain the 4 stages. So stage number 1 is called the deductible stage. Deductible stage, okay? Now Medicare sets the deductible every year. This is 2023, and so the deductible is $505. Now what that doesn't mean is that you necessarily have to show up and write a check for $505. What that means is any kind of a copay that you have on your medication is being applied to the deductible. So if I have, let's say, 2 medications that are $5 copays, and that's all I have, that's $10 applied to that $505. And if my meds don't change all year long, I got 2 copays at $5 each, that's $10. 10 times 12 is $120 out of pocket. You'll never reach your deductible. So if that's your situation, you will stay in stage 1 all year long, okay? You don't move beyond that because we have to meet our deductible first. Many people never do. But let's suppose you're on a medication, let's say it's an Eliquis or a Xarelto, something that's very expensive, and let's say that medication retails for $500. Well, what's going to happen? You are going to show up and you're going to have to not only pay your deductible of $505, but you're going to have a copay for that medication. So that medication actually costs you probably about $550 for the first fill. All right, that's painful. But because now we have met our deductible, we are done in stage 1 and we are going to move to stage 2. All right, stage 2. Now, we just call this the initial coverage stage, initial coverage. All right? And basically what you have here is you have copays based upon the tiering of the medication. So remember we talked earlier about the formulary. Every medication covered has a tier number. Usually it's up to 5. Tier 1, 2, 3, 4, 5. The lower the tier, the lower out of pocket for you. And so what this simply means is if I'm in stage 2 because I've met my deductible or maybe the plan waived the deductible, now what I'm going to do is pay very reasonable copays for my medication. Let's go back to my example of Eliquis. It's an AFib medication. In this stage, your copay is going to be about $45 a month. Okay, that's it. Now that medication still retails for $500, but once you've met your deductible, you just have to pay your copay because now we're in stage 2. And so who makes up the difference? Well, that Part D plan that you bought for $25 a month, they're paying that extra $450. You see the point? And so what's going on here is you just pay copays. But here is where Medicare plans are different. While I'm in these stages, what's happening, I met my deductible, now I'm just simply paying my copays, but Medicare is still tracking the full retail cost. Okay, you're not paying full retail other than the first fill, but in this example, if I paid the $505 in January, now at February, March, April, May, June, July, and August, and September, for the next 9 months, all I'm doing is paying that copay, $45. But again, remember what's happening. Through the Medicare system with the pharmacy and the Medicare system, they're tracking the full retail cost. And so if that full retail cost of all the medications that you're taking ever reaches what is called the threshold, and this year, that threshold is $4,660. Now, the key to understand this, that is retail cost. That is not your cost. As a matter of fact, you probably spent about $1,000 out of your pocket, but the plan paid the difference. But Medicare's been tracking the retail because if I ever hit that retail number, I will be done in stage 2 and I will go to stage 3, which is called the coverage gap. Slang for it is called the donut hole, right? So why do people get to the donut hole? Because they have reached the retail threshold. Now they tell us that about 10% of all people will hit that number. 90% of you will never do that. You're not taking meds where they're expensive enough to reach that number. But if we ever do, that could be in my example of Eliquis, 9 months? If you're on a medication right now, self-administered chemotherapy pills, they're $7,000 a month. Well, how long does that take you? About 3 weeks to get there. Had a gentleman recently that took a medication that cost $16,000 a month. He told me it keeps him alive, 16 grand. How long does it take to get to the threshold? Less than 1 week. And then he would be done here and he is going to move to the donut hole, to the coverage gap. So if we ever reach that threshold, retail, then we're going to be done in stage 2. We go to stage 3, which is called this coverage gap or the donut hole. Now what happens here, now we have our 3rd stage, therefore our 3rd copay if we're here. And it's very simple here because what's going on now is we just pay a flat 25% of the retail cost of that medication, whether it's a generic or a brand name, retail cost. So if I'm on a let's say $100 retail cost of medication, I'm in the coverage gap, it'll cost me out of pocket $25. Let's say I'm on Eliquis, it retails for $500 a month. Again, 25% would be what? Would be $125 if I'm in the donut hole and I'm on Eliquis. So remember, my first fill cost me about $550. My next 8 to 9 fills cost me $45 a piece, but now I'm in the donut hole, so that copay went up to $125. Now we have an entirely different number that Medicare is tracking. And this year, that number is $7,400. Now, this is actually called true out-of-pocket. I personally don't think that's a great way to define that, because it looks like that's your out-of-pocket expense, and it's not. This $7,400, and just so you know, they say about 1% of the Medicare population will ever reach that number. But if I ever reach the true $7,400, then I'm going to go to stage 4, which is called catastrophic. Okay? Catastrophic. Now, real quickly, just so you understand, that $7,400, the reason I don't think that'll call it true out of pocket, because it looks like it's out of your pocket, it's not. What is here is your 25% that you spent, and then the manufacturer's discount on the brand names. And by the way, people don't get to the donut hole usually because they're on generics. They get there because of brand names. So while we're in stage 3, the manufacturer must give a 70% discount off that medication. So if I'm on a $500 retail medication, then I'm going to get a 70% discount. That's $350. I only had to pay 25%. And that $350 is credited towards that $7,400. You didn't pay for it, but the manufacturer discount was credited as though you did pay for that. Okay, that's why I'm saying most people don't get that number to that number anyways. But if you do, if we ever reach that, then we're going to go to stage 4, which is called catastrophic. Everyone's happy here because now the most we'll pay for a medication would be 5% if we get to catastrophic. And again, they say 1 out of 100 people get there. And so as you can see, let's use our Eliquis as our example. If I'm on Eliquis, it retails for $500 a month. My very first fill, I met a deductible of $505, had a copay of $45. So in January, that medication cost me $550. But I'm done in stage 1, go to stage 2, February, March, April, May, June, July, August, September. I just pay $45 copay, but the total retail cost finally reaches that number there, pushes me into stage 3. I pay 25%. 25% of $500 is $125. And if I ever get out of the donut hole, then I'll go to catastrophic, and now that medication only costs me 5%. So that same medication has changed prices 4 times. So $550, $45 through September, $125, and then if I get to the catastrophic stage, it costs me $25. All right, so we have these fluctuating copays depending upon what stage you're in and the total amount of medications, retail costs that are pushing you through this particular system. Now keep in mind, if you have an Advantage plan, you have these 4 stages. If you have a separate drug plan, when you go with the supplemental plan, again, you have those 4 stages. The Advantage will include a drug plan, usually at 0 premium. If you have a supplemental plan, you have to buy a separate drug plan. Average is about $25 right now. Okay, and so sometimes we have a premium, sometimes we don't. The most important thing is not premium. Most important thing is the formulary. The medications that you take, you want them to be covered by your plan. All right, now some of you who take no meds may be tempted to not get a plan, or maybe you take very cheap medications and you find that you can buy those meds through GoodRx or some other kind of discount program at less than what you could through the plan. And I understand that. But listen, you don't know what could happen in the future. 3 months, 6 months, 9 months, you may need a drug plan. If you don't have one, you can't add one at any time. You can only add one during the Medicare open enrollment season, October 15th through December 7th. So if you don't get a drug plan now, when you're eligible and you need a medication, let's say in March or April or sometime, you just can't add one because you need a medication. You have to wait till you can enroll in that plan, and the new plan will go into effect January 1. So listen, get a drug plan. Get just an inexpensive one. Get a little $7, $10 drug plan to make sure, just in case you need something beyond what you're taking now, and Medicare will then cover that medication at a drastically reduced price than you happen to be cash out of pocket. So everyone needs your drug plan because, again, we'll spend more money on medications than anything else with healthcare today.